I think we have learned over the last decades a lot in aesthetic medicine, and we have done many things wrong because we just did unnatural results, or we overfilled patients. Regenerative medicine and regenerative aesthetics means we are using the body functions, their own cells, to really have or keep up a young skin or a young appearance by really having our own body functions still working or restoring our cells. I can answer this question like this. I have used biostimulators probably since 2002, and I learned that we need to use the most safest product as possible, because biostimulation can go through different pathways. The main pathway of most of the biostimulators is inflammation, because the immune system reacts, and then you have kind of an uncontrolled biostimulation. So in my hands, the one substance which is mostly studied scientifically and really known for a long time is calcium hydroxyapatite. And it's the so-called Radius on the market here. We have it on the market since 2007 in Germany. And I can tell you it's really the biostimulator acting mostly through mechanical activity. And then on top, it doesn't only induce, the fibroblasts to do collagen fibers or elastin fibers. No, it adds the whole to the surrounding tissue by stimulation. So we see in these areas not immune cells, but we see new vessels coming, like microcirculation, which is necessary for a healthy skin, for young skin. So the biostimulation with calcium hydroxyapatite is not only inducing collagen, it's inducing much more. Thicker skin, proteoglycans, elastin fibers, angiogenesis. So it's much more, it's not only collagen stimulation. And this in a healthy way. You see, CAHA is on the market since so many years, and we started with this diluted CAHA from Radius about 6 to 7 years ago. And then it came from Brazil, actually. A colleague from Brazil started diluting and doing that together with a colleague from Russia. And since then I have experience with that, using it, especially face and neck. So it has now a very well recognition in Europe, but it took time as well, of course. We see that the other biostimulators, we just have 2 or 3 others. We don't have so many as you have here, but we see that the other biostimulator have 2 main, not only inflammatory biostimulators, but they have 2 other issues. Not scientific work has been done. It's a huge issue. I think with CAHA we have more than 200 studies, scientific studies with outcomes. Plus CAHA, especially the Radius product, has very similar microspheres shaped, round, smooth. So we don't see issues, we don't see safety problems. It's kind of easy to inject, and our patients are really happy. And the feedback comes after like half a year. So we have to wait for the result, but then it's supernatural. It's your own skin, which is the result. And that's unique, and our patients love it in Europe. So in my hands, CAHA is used in a diluted version. I think the most used CAHA in my hands is really the neck, because in the neck we have nothing to offer really with hyaluronic acid. Many patients first start with hyaluronic acid, but you can't do that in the neck. So here the biostimulation is key. And in the neck, the skin, and especially Caucasians, is super thin. And when they have had some sun, UV damage on top, and it's even more thin, early, like in the beginning of the 40s or 30s already. So here the biostimulation is key, and I'm using also there subcutaneous with 2 or 3 insertion points per side, subdermally, very superficial, the product. In a higher dilution when the skin is thinner, because I want the more even distribution. And on the face, usually I'm using a 1:1 dilution because it evens out little wrinkles on top, a little bit like this as well. Well, again, it depends what I'm feeling, how thin the skin is, what I'm seeing, and how the subcutaneous connective tissue is. Is it tight or is it loose? And then my dilution changes. For the implementation manually, for us doctors, to distribute it correctly, it's kind of a slow, easy learning curve. So she has to do the dilution correct and on the spot, fresh. Not prepare before, let it sit, and then it will separate again. So more CAHA here, less in the saline solution. So then you have to dilute it, mix it again in a very even mix, and then you inject. So I think the biggest challenge is that you have the right dilution in a diluted, even dilution manner. That's more important than your skills. Maybe a little bit my background again. I run also a research facility only for new products, who come to the market since more than 10 years. And I truly believe we should have our homework done with science before we inject something in the body of a patient. And here now with this calcium hydroxyapatite in radius, it's used worldwide, million-wise, before as a filler, now as a biostimulator. I think we are super safe, yes. And this is, maybe my recommendation for patients to look exactly what they get injected in their body. This is what I can really share with you after 27 years here in the aesthetic field. So first I think it's the doctor's knowledge and the doctor's experience what to tell or what to give to the patient. And we have for skin qualities, we have these EPCs. So these are the skin quality categories, like skin firmness, where radius is super important. Skin surface evenness is with radius or hyaluronic acid. Skin tone evenness, that's more with lasers, but also skin function leads to good skin tone evenness, as well as pore size, glow, that comes on top more or less with like microtoxins. So I think it's up to the treating physician to choose the best for the patient, not the patient because they've seen Instagram, for example. Okay, it's knowledge and experience matter. I think I never want to work without biostimulators in my life anymore, but it's kind of new in some areas. And the outcome is your healthy own skin. I combine, of course, also with like microfocused ultrasound with visualization or therapy. It's a win-win situation, as well as if you want to hydrate from outside or microtoxin superficial, it's also a win-win situation, depending on the assessment and the diagnose, more or less, what we do as a doctor. Okay? Well, my take-home message for the Korean doctors is even if you start off in younger ages with a thicker skin than Caucasians, but you do go into this aging process similarly at the maybe a little different or later. So biostimulation is definitely also a key element to introduce to your patients. Let them understand what it means, because it doesn't show the outcome in a minute. It takes time until your body reacts. And when the patient has learned the natural, the nice, and the very healthy outcome, they will appreciate it very much. It's a little more education for doctors and patients in the beginning, but then they will all come back with no further, well, marketing, whatever. You don't need it anymore. They will love you.